Podcast 7 of the Abdomen series, the pancreas, gall bladder and biliary system. This podcast will begin by detailing the anatomy of the pancreas and then the gall bladder, and will finish by describing the biliary system and the movement of bile. So the pancreas is a leaf-shaped accessory digestive organ that is retroperitoneal and positioned transversely within the abdominal cavity at roughly the level of the first lumbar vertebra, which is also the transpyloric plane. It is posterior to the stomach and has the spleen to its left and duodenum to the right. Emerging from its anterior surface is the root of the transverse mesocolon. Functionally, the pancreas is composed of both exocrine and endocrine parts. Its exocrine secretions are the pancreatic juices, which are made in the acina cells and emptied into the duodenum via the pancreatic ducts. Its endocrine secretions are of glucagon and insulin, and these are made in the islets of Langerhans, and they are released directly into the bloodstream. Descriptively, the pancreas can be divided into 4 parts. There's the head, neck, body, and tail. The head of the pancreas is the larger, most expanded part of the gland, and it fills the concavity of the C-shaped duodenum, attaching to its descending and horizontal parts. Projecting slightly inframedially from the head is the uncinate process. This part extends medially along the horizontal part of the duodenum and is positioned posterior to the superior mesenteric artery and vein. The neck of the pancreas is positioned in front of the superior mesenteric vessels and is directly behind the pyloric sphincter. The body extends to the left, passing over the aorta, and forms the floor of the lesser sac. The final part of the pancreas is the tail, and this part sits anterior to the left kidney and is the most mobile part of the pancreas. It extends towards the spleen by running between the 2 layers of the peritoneum that form the lino-renal ligament. You can imagine the relationship between the pancreas and these 2 mesenteric vessels by making a C shape with your thumb and index finger. Your index finger represents the body and neck of the pancreas, with the proximal phalanx representing the neck. Your thumb can represent the uncinate process, and the flap of skin joining the index finger and thumb is the pancreatic head. If you then pass your index and ring fingers from the opposite hand through this C shape, so that your 2 fingers are resting on top of your thumb, these 2 fingers can represent the superior mesenteric artery and vein, and you should be able to observe the relationship between the pancreas and these vessels. These 2 superior mesenteric vessels should be lying anterior to the uncinate process and posterior to the neck. Try it, and hopefully this will help you to remember the relationship. Running through the pancreas from left to right is the main pancreatic duct. As it passes through the gland, it drains the various lobules that are producing the pancreatic juice, and at the head it unites with the bile duct to form the hepatopancreatic ampulla. This is situated in the wall of the descending part of the duodenum. The ampulla is surrounded by a layer of smooth muscle which forms the sphincter of Oddi, and under autonomic control, pancreatic juice can enter the duodenum through the major duodenal papilla. Commonly, there will also be a minor pancreatic duct. This duct drains the lobules from the lower part of the head and uncinate process of the pancreas, and it travels superiorly through the head to open into the duodenum via the minor duodenal papilla, which is located superior to the major duodenal papilla. So to finish the first part of the podcast, let's detail the blood vessels that supply the pancreas. Now, as I mentioned in podcast 4 of the Abdomen series, the head and uncinate process of the pancreas are supplied by both the superior and inferior pancreatico-duodenal arteries, and these form a series of anastomoses between the head of the pancreas and the duodenum. To remind you, the superior pancreatico-duodenal artery comes off the celiac trunk via the gastroduodenal artery, and the inferior pancreatico-duodenal artery comes directly off the superior mesenteric artery. The neck, body and tail of the pancreas are supplied by numerous pancreatic branches that come directly from the splenic artery as it runs behind the pancreas towards the spleen. The venous drainage of the pancreas mirrors that of the arteries, and they drain into the portal system. Now, before I detail the biliary system, let's just briefly detail the gallbladder. So the gallbladder is a pear-shaped sac found in the gallbladder fossa on the inferior visceral surface of the liver, and it is situated to the right of the quadrate lobe. It has a body which is in contact with the visceral surface of the liver, and a dilated fundus which sticks out from under the inferior border of the liver. The neck of the gallbladder joins the body to the cystic duct, and has its mucosa elevated into a series of ridges which forms a spiral valve, and this valve ensures the entrance to the gallbladder is kept open. Finally, the gallbladder is supplied by the cystic artery, which is a small branch that usually comes from the right hepatic artery. So to finish the podcast, let's detail the biliary system. So the biliary system is a network of connecting ducts that join the excretory accessory digestive organs, and there are the pancreatic ducts, the hepatic ducts, the cystic duct, and the bile duct. So the two hepatic ducts, the right and left, drain bile that has been produced from the hepatocytes in the left and right parts of the liver, and as these ducts leave the porta hepatis, they converge to form the common hepatic duct. As the common hepatic duct passes inferiorly, it is joined on its right side by the cystic duct, which is coming from the gallbladder. The union of the hepatic duct and the cystic duct forms the bile duct. The bile duct then runs within the free edge of the less omentum, alongside the hepatic portal vein and the hepatic artery. These three structures in the free edge of the less omentum form the portal triad, and within the portal triad, the bile duct is located most anteriorly. The hepatic artery is posterior and to the left of the bile duct, and the hepatic portal vein is also posterior to the bile duct, but is to the right of the hepatic artery. The bile duct extends posterior to the first part of the duodenum, in a groove on the head of the pancreas, and here it unites with the main pancreatic duct to form the hepatopancreatic ampulla. This ampulla is surrounded by a thickening of circular muscle that forms the sphincter of Oddi, and it opens into the second part of the duodenum via the main pancreatic papilla. So this biliary system is an important network of ducts that allows the flow of bile and pancreatic juice to enter the digestive tract and aid the breakdown of the intestinal contents. The entry of bile and these enzymes is regulated by the autonomic nervous system, which innervates the sphincter of Oddi that surrounds the hepatopancreatic ampulla. With parasympathetic inputs, this sphincter will relax, allowing both the bile and pancreatic juice to enter the duodenum as part of the rest and digest response. With sympathetic inputs, this sphincter will constrict, preventing the flow of bile and pancreatic juice from entering the duodenum, and as bile is being continuously produced by the liver, it backs up into the gallbladder via the cystic duct. The backing up of bile into the gallbladder is aided by the spiral valve of the cystic duct, and this keeps the entrance of the gallbladder open so bile can enter to be stored and concentrated. So in this podcast, I've described the anatomy of the pancreas and the gallbladder, and how the ducts associated with these organs form the biliary system. In the next podcast, number 8, I will detail the arterial supply and portal system of the abdomen.